it's always intriguing to see how many of the patients you interact with, you form a bond even in a short period of time that you feel like you really want to know how they are doing. And that's the one aspect of global health that I believe is quite rewarding and appealing to be done again and again.
Hello and welcome to our WInnovations podcast. I'm your host, Dr. Kyle A. Richards. I'm very excited for our program today. We are now in our second season of WInnovations, and we're thrilled to be back in the studio in the Department of Urology here at the University of Wisconsin. Now, the purpose of these podcasts is to highlight some of the exciting and innovative work being done at the University of Wisconsin. For this season, we're bringing in some expert guests from outside the department to provide some unique perspectives and to highlight some of the collaborative efforts that are required to innovate. Now, without further ado, I'd like to intro our wonderful guests for today, Dr. C.R. Powell and Dr. Walid Farhat. Dr. C.R. Powell is an associate professor in the Department of Urology and Obstetrics and Gynecology at Indiana University, where he is the service line leader for the suburban practice. He did his urology residence at the University of Illinois, followed by a fellowship in female pelvic medicine and reconstructive surgery at the University of Iowa. And I've really enjoyed getting to know C.R. Powell over the past several years via the AUA in the North Central section. So welcome to the program, C.R.
Thank you. It's a tremendous honor.
And we also have our very own Dr. Walid Farhat, who is a professor in the University of Wisconsin, Department of Urology, and Chief of Pediatric Urology. He holds the Mark and Karen Coolidge Chair in Urology and is the Director of Global Health for our department. He completed his residency at the American University of Beirut, followed by a fellowship in pediatric urology at the Hospital for Sick Children in the University of Toronto. Both Walid and C.R., I know, are very passionate about their respective fields, but also have a special interest and perspective on global health, which is why I thought it would be great to bring them together tonight. So it's truly amazing to have these thought leaders with us in the studio to discuss the topic for today, which is a urologist's role in global health, New Horizons. So welcome to the program, Walid and C.R. Thanks for being here. Now, I like to start out getting our guests to pay homage to some of their mentors. One of my mentors, and I know Walid knows him well, was the late Dr. Gordon McClory, when I was a resident at Wake Forest, and I really looked up to Dr. McClory. But Walid, who are some of your mentors that really helped shape your perspective as an academic urologist?
You know, Kyle, the list is possibly quite long to be able to go through it. There are many people, including the late Dr. McClory, who basically used to talk about the different things he did when he was on missions outside Toronto. But the truth is that coming from a third world country myself, I had the opportunity to see people come and visit us at the American University of Beirut for many, many years. And when I came to Toronto, we had what we called as No Boundaries Mission, which was collectively a group of pediatric surgeons as well as otolaryngologists and dentistry. So there is one individual who really stand out as an individual. I look highly at his work. He was a dentist. He was the chief of dentistry in Toronto. And he left Toronto, went to Vancouver, and we kept in touch. And he was the one who kind of opened the door for me to start being active at the No Boundaries mission at that time.
That's fascinating. Working with a dentist, who would have thought a urologist and a dentist, but that's great. What about you, C.R.? Who are some of your mentors that maybe got you interested in, it could be, your specific field, but also maybe within global health?
Well, it's so interesting that Walid was mentored by a dentist, because I was going to make the point, an internist by the name of Dr. Charlie Kelly, who was a professor in internal medicine, the School of Medicine at Indiana University, was instrumental in piquing my interest in global health. And so he put me at a mission hospital. He was one of the coordinators in the fourth year of medical school that put students like me who had an interest in these kinds of things in hospitals in under-resourced parts of the world. And so because of him, I spent 2 months at a place called Tenwick Mission Hospital in Kenya. And I've gone back there ever since. And so that was over 20 years ago. And another guy was a general surgeon, not a urologist, who I met at Tenwick Mission Hospital by the name of Dr. Mike Chupp. And he served for 20 years at that mission hospital as lots and lots of roles, but basically the only surgeon for miles and miles. And they're still both a very important part of my life. I talk to them on a pretty regular basis, both of them. So I think the point is, I think from both Walid's experience and my experience, a mentor doesn't have to be a urologist if you happen to be a urologist yourself. And I feel very fortunate that some of the great mentors I've had remain an important part of my life, even more than 20 years later.
That's great point, CR. Now, Walid, you sort of touched on how you started to become interested in global health, but how did that passion really kind of grow within so that it became really such a big part of your career and your life?
Kyle, this goes back to the patients, the population that you serve, kind of entice you to keep on doing it. And again, with the multiple visits I have done early in my career, it became evident that as you go with different disciplines, you realize that you get called to see things that you have not been prepared to see. And by virtue of seeing new diagnoses or new patients who were not even on the list of people to be seen, it gives you an idea about the depth of the need in those countries. And that by itself was really a stimulus for me to come back and say, I want to go back again and I want to do it again. It's always intriguing to see how many of the patients you interact with, you form a bond even in a short period of time that you feel like you really want to know how they are doing. And that's the one aspect of global health that I believe is quite rewarding and appealing to be done again and again.
And I'll flip it to you, CR. I'm sure some similar things resonate with you, but anything more specific that you'd like to touch on?
Yeah, well, I love what Walid said about the people that you meet. That's what really gets me coming back over and over. But why I'm interested in global health is actually tied to why I left engineering to become a doctor. I was studying electrical engineering at Purdue University, and I became a Christian, and through all that process, I came to understand the world was a whole lot bigger and much more diverse than I ever really thought. And I guess like Walid, I saw the need and read a lot of stories, had never been there myself, and so really felt a strong call to kind of go and just go and see myself what it was like. And it really changed the whole course of my career, really, because my goal was to get a job as an electrical engineer and start a company someday. And then I got diverted into medical school through an interest in global health.
Now, CR, you mentioned Kenya, I believe. What are some of the other places that you've routinely traveled to or been to, and what were some of those experiences like for the listeners? I think that'd be helpful to kind of describe those experiences, especially for people that maybe haven't been on a global health trip before.
Sure. Well, I go to Kenya every year. I take 2 of our Indiana University residents, but it's certainly open to other residents as well. And I've been going to Africa for about 20 years now. I feel like I'm not old enough to be able to say that, but that's just the reality. I had to check the other day.
You look young, CR.
Yes. I did spend 2 months in Ethiopia when I was an undergraduate, and that was very formative for me as well. I really learned to depend on people that grew up in a very different situation than I did, and I think that was a valuable experience, Kyle. I came to depend and trust in people that I didn't know 2 months prior to that. And, really we could not have been more different. And it really was formative for me. But since then I've been to Gabon. I go to Gabon every year. I train African residents in Gabon, actually. We're trying to make this a self-sustaining program. And to date, we've trained 147 residents over the past 26 years or so.
Wow.
Obviously not me, but I've been a part of that program. And then I've operated most recently with my 14-year-old daughter, believe it or not, in Monrovia, Liberia over Thanksgiving. And that's been the most recent place that I've been.
Fascinating. Walid, what about you? Where are some of the places that you've traveled to and done some global health work?
Initially with the No Boundaries mission that I talked briefly about, we used to go to different countries with different disciplines. I went to Jamaica, to Peru, but most recently, and I think that's, again, the silver lining of COVID, we initiated virtual global health initiative with different countries. So prior to the war in Ukraine, I used to go every year to Lviv on the west side, and I used to operate there and I trained people there, and then some of them will come to Toronto some of the patients also would come to Toronto to be operated. Currently, I divide my attention between the virtual curriculum that we have with Ukraine as well as the virtual curriculum we have with Lebanon. I came recently from Lebanon on a medical mission there. I operated on a lot of patients who unfortunately don't have access to pediatric urology. And very soon, hopefully, we'll start going to Ethiopia too. And the multiple countries that I believe had given me the chance to see again and again that, getting to know the country is so important, and one trip to a single country or changing countries may not be as beneficial as sticking with one single country for a while to make sure that you're giving enough service and sustainability for that kind of medical mission.
Yeah, the virtual mission is intriguing. How did you come about that? I think a lot of people listening in maybe don't know what that entails or how you set that up.
As you know, in any trip you want to go to or any medical mission, I'm sure CR would agree with me. It's always good to know what you're going to see there and what you're going to leave behind after that. Sustainability is one of the biggest concerns with medical missions, and this is why it's not really volunteerism as much as knowing what the resources there and what you're going to leave behind. So traditionally, when I used to go to different countries, specifically to Ukraine, I tended to have a video visit with them prior to the trip, or at least have them email me the list of cases we're going to be doing and discuss them ahead of time, which is the natural thing to know what you want to be doing and what you want to take with you, even from instruments all the way to things that they may not have access to. And with COVID and with me relocating to Madison, it occurred to me that one of the things that we could offer them is basically have a monthly meeting. And this is really what have been going on for the last 2 years and a half. We have monthly meeting where we discuss cases and we help them on managing cases. And we also get to advise them on some of the different aspects of things that they would like to improve. I mean, I'm super proud to know that they got their abstract accepted to the AUA from the work we have done together on kidney transplantation during the war in Ukraine. We actually mentored them on how to put all the data together, and we reviewed some of their cases prior to the transplantation. And I always say to people that sometimes, and I'm sure CR may agree with me, that sometimes a conversation with some of those outstanding surgeons in those different countries may be all that they need, because it's more about decision making more than incision making. I mean, they are so skilled. All what you need to do is just talk about how they can do it differently. And that by itself had been really successful. So we have also a lot of activities with different programs. For instance, with Lebanon, we get them to attend our research meeting. So for me, I feel like this is part of the medical missions we do. So by the time I land in Beirut or I go to Ukraine, hopefully soon, I know what they have, and I have talked to them for an extended period of time, so I know what I'm going to leave behind when I go in and out, if that makes sense.
That is really cool stuff, Walid. Fascinating. CR, I'm going to toss this one to you because I think I know the answer to this, but you might hear people say, well, we have a lot of problems here in the U.S., right? Our healthcare system, our hospitals. Why go somewhere else? Like, why don't we just focus our attention on fixing problems here in the U.S.? So what would you say to that?
Well, it's a great question, and I think it's true. We do have problems. What I say to that is most definitely get involved in your local community. I don't think it's an either or question. I think it's an and question. And so I think you can get involved in both. I work at a community clinic about 10 minutes from one of my clinical sites. Once a month, I volunteer there. I think it really enriches the experience that we can have. And so, may I circle back to something Walid said, though, Kyle? I'm just so fascinated by it. So, Walid, you're going to Ukraine even in the midst of war. Is that correct?
I'm sorry, I misspoke maybe. I stopped going since the war started, but I continued to maintain my relationship with them through virtual curriculum. And I have to say, I'm always willing to consider going because, again, Lviv is 60 miles or 45 miles away from Poland. So it's always safer to go there. But no, I did not yet go back since the war started. But I maintained my relationship with them, and I actually had, with the support from the department, we were able to support them with medical instruments and other stuff for kids there.
Now, CR, you mentioned that at Indiana, at your institution, that residents have the opportunity to do global health with you. Are there other opportunities at your institution for folks to get involved in global health?
Yeah, we have a 25-year relationship with Moi Teaching and Referral Hospital in Eldoret, Kenya. And so that program has been the recipient of multiple grants, both federal and private, like the Bill and Melinda Gates Foundation. And so we have a steady stream of medical students and even students from other institutions that stay at we call it the IU house, but we have a gated facility in Eldoret, Kenya that's 1 mile from the hospital. And so, yeah, we take all kinds of people. We have pharmacists, we have pharmacy students, we have we used to have a big cohort of Kenyan medical students that would come, and we would literally do an exchange. And the medical students would do a year at Indiana University, and our Indiana students would do a year in Kenya. And we've had a lot of opportunity for collaboration. And I think it's been not just doctors, it's been a lot of different people.
That's great. And Walid, anything else at University of Wisconsin for global health opportunities for folks listening that might be interested, for students or other providers?
Yeah, there is a large group of surgeons who come together frequently to really discuss the activities that they can do in Ethiopia, specifically through Girma, who is heading the Global Health Center at the University of Wisconsin. And I am anticipating that with us getting residents involved and engaged in some of the activities, I mean, we had, Marissa, prior to her graduation last year, was very active with the virtual curriculum with Ukraine. I am always open to the idea of having residents be involved in some of those medical missions. And again, I think it would be important for them to be engaged in knowing the details of how to set it up, because one of the reasons to why people shy away from continuing to do medical missions is that they feel like they have failed when they go on 1 or 2 medical missions and they can't achieve what they want. This is why I think we're lucky to have Girma Tefera is working on putting together a really solid system for us so we can go through a program rather than spontaneously go as an individual and make plans without having a foundation for such a work. So the opportunities are there, and it's all dependent on when we are ready to start having our residents really look into it. Some of our residents are being involved in writing. I am actually co-authoring a paper with Kelly McQueen, the chair of anesthesia, who's also a champion in medical missions, on the medical missions in pediatric surgical specialties, because it's, again, different than what CR does in adult world.
Yeah, that's great to know. And Girma Tefera is a vascular surgeon at UW for those tuning in. And Marissa Falkovitz was one of our former residents. So yeah, we definitely have a good growing interest in global health at University of Wisconsin. CR, I know you've done some really great work within the North Central section on global health initiatives, but can you describe a little bit about what organized urology is kind of doing to help support global health initiatives?
Oh, I'd love to. I'm so glad you asked. So the North Central section actually offers a scholarship for 2 residents. We'll sponsor up to $4,000. And actually we had, I believe, some University of Wisconsin residents apply this year. We had a better turnout than we've ever had. We had 12 applications for 2 scholarships. And so they have been very generous in trying to make sure that these trips can be funded. And that's open to anybody who wants to go from the North Central section. And it is usually we require that they have a mentor, someone like Walid or myself, who has been before, and someone who can make sure that it is an educational experience. But many of these trips are facilitated by the International Volunteers in Urology group, which is amazing. But many are not. Like, it sounds like you have an amazing experience at the University of Wisconsin. I think we have a good experience at Indiana University. And there are other people around the North Central section that also sponsor residents in going to these kinds of programs and are happy to go with them, even if they're not from their institution. So lots of cool opportunities.
Yeah, and thanks for spearheading a lot of that. I know when you were on the board for the section as the Indiana rep, you really pushed a lot of that through, and I think that was fantastic. So congrats, CR. Walid, any other initiatives that you're aware of that are out there within organized urology, AUA, pediatric societies, anything that our listeners might be interested to know about?
Kyle, there's an initiative that's quite popular. It's called the Global Initiative for Children's Surgery, GICS. I would say it's really a great opportunity for people who are interested in pediatric surgical missions. And the other one is the American Pediatric Surgical Association, APSA. Both APSA and GICS are really active, but you can never miss on Catherine DeVries and what she had done with the IVU. I mean, she had done an outstanding job at establishing really a major kind of cornerstone for pediatric surgical specialties or pediatric urology in general. And I want to take an opportunity and with this podcast, Kyle, to advise residents or whoever listen to this podcast to really look at her paper that she wrote in the Journal of Pediatric Urology on medical missions and pediatric urology, and she gives an outstanding rationale to why medical missions are a unique opportunity for improving care around the globe.
Yeah, thanks for that, Walid. When we release the podcast, maybe we can include that as an attachment or some way so that our listeners can access that, because I think that would be a great adjunct to everything we've discussed. And that's for the International Volunteers in Urology, right? IVU Med, that's the organization you're referring to?
Yes.
Great. I wanted to go into a little bit more of maybe the benefits and maybe some of the challenges facing global health. You've kind of touched around this a little bit, CR, but if you're trying to sort of, I don't want to say, well, maybe sell global health to people that are maybe thinking about doing it, what for you, what are the benefits? I mean, when I was in undergrad, I spent a couple of weeks in Central America, in Nicaragua, and did some rural medicine. And for me, it was just that the feeling you got when you're helping these people out that clearly, didn't have very much. But is there more to it than just the feeling that you get that you're doing something good? Or what are your thoughts on that, CR?
Yeah, I'm glad you brought that up. I tell you, we all like to give back. None of us would be in healthcare if we weren't powered by giving back, if we weren't energized by the ability to make someone's life a little better. And I think that's what we all love about operating. We can see a big difference, and global health is that personified 10 times over. And I think what really struck me was over Thanksgiving, I took one of my fellows and my daughter to a country I'd never been before, but my good friend and trusted friend who I met when he was an intern in general surgery in Africa, Dudoni Lamfuka, has become chief medical officer at a mission hospital in Monrovia, Liberia. And so we went to work with Dudoni. And to be able to see one of your former residents who was not born in the U.S., was not born with a lot of opportunity handed to him, really be the chief of staff, really make an impact on literally, he does about 1,500 cases to 2,000 cases a year. I mean, it makes me look like a lazy slob, and he's saving people's lives. And I mean, he's doing urology, he's doing neurosurgery, he's a general surgeon, he's doing, you name it, and he's doing C-sections. And that's exciting. It's exciting because you look at Dudoni, you look at the impact that he's making, and you think, I had a tiny, tiny role in that. And it's exciting. It's humbling. And I don't know, it feels like you're fulfilling your purpose.
Yeah, sounds like a really great feeling. Thanks for sharing the story, CR. What about you, Walid? What do you get out of this whenever you're working with Ukrainians or traveling the world? What is it that keeps bringing you back?
CR put it quite well. I mean, we all went into, to some extent, we went into medicine because we wanted to help. And there's an element of super satisfaction, I would say, knowing that you're doing it and you know that there's no return on your investment beyond seeing a smiling face at the end of on the other side of the desk or the operating room or the family. There's some element of feeling that now you're fulfilling your whole vocation of being a surgeon. And I don't know how to express it, Kyle, better than saying that this is really the part that makes me feel like I'm doing it for no particular reason, no interest in promotion for me, no interest in revenue for me. It's just being done for the purpose of making sure that I'm doing it primarily as semi-altruistic. I say semi because you can never be altruistic. I'm still getting a benefit. I'm getting happiness out of it. But going back to what CR said, getting other people to go also and residents to see or seeing what other people are able to do in other countries is an awakening for them and an eye-opening for them to know that you have an outstanding and much more giving environment here and you could do more with less resources, and that's what you can learn from those. So for me, I learned a lot from those experiences, in addition to being happy that I'm giving with no return on my investment beyond just seeing happy outcomes, good outcomes.
You guys are amazing. That's just what kept popping into my head. The work that you guys do globally, it's just phenomenal. So thanks for all of that. But there probably are some challenges to global health that you have to grapple with and deal with when you're planning for these trips, going on these trips. CR, what are some of the sort of unique challenges? Maybe it's getting mauled by a wild animal or dealing with bush meats. But what are some challenges that you face?
Well, I was pretty intimidated when Walid was talking about going to Ukraine. What was interesting about what he said was he was talking about how he helped them, publish on kidney transplant. And it made me realize life goes on. They're in a terrible war situation, and people are still getting kidney transplants because life goes on. And I think maybe one of the impediments is you're thrown into situations. I wish I had the skill he had in pediatric urology because I'm often doing hypospadias repairs, undescended testicles, honestly, extrophy epispadias patients, where we just give them a diversion. Stuff I don't feel well qualified to do, but there's nobody else. And if I don't do it, then that's it. That's a real challenge, Kyle, and it's very intimidating for me. But we just do our best, and that's why I think, to kind of touch back on with the thing you first asked us, for medical students and learners, how would they get involved? I think it's really important to go with a mentor, and there are so many people willing to take our residents and our medical students. I think just see that it can be done, and see that, even when you're pushed beyond what you're comfortable doing, the follow-up, it matters a lot. Staying in touch via WhatsApp and email matters a lot. But I think just having that first experience makes a big difference.
And what about you, Walid? What do you think are some of the sort of unique challenges that you've faced doing some of this global health work?
Sustainability will stand out as the most common thing. I always worry about walking out or leaving that place and knowing that whatever we have done is going to fail after we leave because the system is not sustainable. There are two things I would just bring up. It might take more than a podcast to really delve into those things. It's the power imbalance and the ethical and legal aspects of medical missions. And these are things that a lot of people may not understand till they go into those different areas. Power imbalance is because you really need to study the power distribution in that area, because sometimes people may not be very much welcoming when you come on a medical mission, or they may not be also cognizant about what you want to offer them. Second thing is the ethical and the legal aspect. Is I sometimes feel like consents and how you can confirm that you're basically telling people what you want to be doing for their kids is a huge impediment for some of those patients or parents who don't really understand too much about what you're trying to do. And sometimes they just hang on to anything you want to offer them, and you feel like you cannot offer them what they are asking you to. So this is why I feel like, aside from sustainability, I always think about how I want to avoid harm just because I'm pulled or pushed to do something there, or being asked by somebody there who have some form of power imbalance to say, I want to do this. And I sometimes decline doing cases where I know that I most probably will be causing more harm for a patient than helping them. In other words, I mean, sustainability is the big thing, but those few nuances of medical missions are sometimes overlooked and not fully appreciated. And I want to take the opportunity to bring them up.
That's fair, and I think really good points, Walid. I want to just end by asking both of you, what advice would you have for urology providers, or really anyone interested maybe outside of urology that's thinking about dipping their toes into this kind of work? CR, maybe start with you. What would you tell someone? What advice would you give them?
Sure, I'd say find a partner, someone who's been. There are a number of great organizations. The organization that Dieudonné, the resident I mentioned previously, trained under is called PACS, PAACS.net, and that's their website. And we're in 12 countries, and we have almost 20 training programs in those 12 countries. That's a great place to start. I think any colleague that somebody knows that has taken these trips, I think it just starts with a cup of coffee.
And what about you, Walid? Any additional advice that you would give somebody that was thinking about getting involved with global health?
I usually preface it to tell people that this is really not a service. It's a transformative journey. It really enriches not only their personal, but also their professional aspects. And if they are interested in looking at that as a journey, they're going to benefit more from it. I would say you got to study the place you're going to. You got to make sure that you are able to make the place sustainable after you leave to be able to be successful. These are the 3 S's for my success in global health. But I want to just finish by saying that you have to really seek assistance, as CR said. Go with somebody you know, learn about the place, learn a lot about the place, and make sure that you have a sharing approach. Make sure that you speak to the surgeons who are there or the people that you want to be working there with them, and foster sustainable partnership. Talk about this before you go and while you're there. And again, aside from the ethics, the legal aspect, I would just bring up again and again, cultural sensitivity. There is a lot of differences between what we do here and what we do in different countries. That cultural difference can sometimes be taught prior to you going. So I tell people when I used to go to Ukraine or other countries, there are apps you can learn about their habits or their cultural differences. Just look at them, know what they mean. It's different than just landing there and treating people the same way you treat in Toronto or in Madison, if that makes sense.
No, that makes a lot of sense. And I think that's a good place to end, Walid and CR. This has just been a fantastic conversation. I've learned a tremendous amount. I've gotten goosebumps at various times hearing you guys talk about just the transformative experience that you've had on these global health missions. And I just am really admiring you guys for the work that you've done. And this has been just a great conversation. Any last words that you guys have that you felt we haven't covered?
I just really appreciate the opportunity, Kyle, and how kind you've been to both of us in letting us come in and speak about something that we're clearly both really excited about.
Likewise, and it's great to have a chance to talk to CR. Maybe he and I will talk about those complex pediatric cases that he's doing, so we can do them together and have Indiana and Wisconsin just partnership on getting better care for those unfortunate kids.
That's how these things start. That would be amazing.
Look forward. Thank you, Kyle.
Yeah, I'm trying to help make these connections too for our friends here in the section and really around the country. And this has just been a lot of fun. So I just want to thank you all for tuning in to our podcast on a urologist's role in global health, New Horizons. I want to thank our Department of Urology, as well as our chair, Dr. Steve Nakata. Our producer is Sandra Miller. And signing off, hope you all enjoyed this episode.
WInnovations is a production from the Department of Urology at the University of Wisconsin-Madison School of Medicine and Public Health. Thanks for listening.